Criminology Board Exam Reviewer. Forensic Medicine. Part 1. Forensic Medicine. It is the science that deals with the application of medical knowledge to legal question. Clinical Forensic Medicine. It involves an application of clinical methods for the administration of justice. Paulus Zacharias. He is father of legal medicine as well as father of forensic psychiatry. Medical ethics. It deals with the moral principles which should guide members of the medical profession in their dealings with each other, their patients and the state. Medical etiquette. It deals with the conventional laws of courtesy observed between members of the medical profession. A doctor should behave with his colleagues as he would have them behave with himself. Hippocrates. He, the father of medicine, discussed lethality of wounds and formulated medical ethics. Forensic pathology. It deals with the study and application of the effects of violence or unnatural disease in its various forms in or on the human body, in determining the cause and manner of death in case of violence, suspicious, unexplained, unexpected, sudden, and medically unattended death. Pathology. It is the precise study and diagnosis of disease. Pathologist. A medical doctor who conducts an autopsy. Autopsy. It is the post-mortem examination of a corpse. Other names of an autopsy. 1. Post-mortem examination. 2. Necropsy, particularly as to non-human body. 3. Autopsy a cadaver. 4. Obduction. Objectives of autopsy. 1. To find out the time of death. 2. To find out the cause of death. 3. To find out the manner of death, whether accidental, suicidal or homicidal. 4. To establish the identity of the body. 5. In newborn infants, to determine live birth or viability. Exhumation. It is the digging out of an already buried body from the grave. Disease. It is an abnormal condition affecting the body of an organism. Cadaver. It is also called corpse, is a dead human body. Carcass. It is a dead body of an animal. Injury. It is the damage to a biological organism which can be classified on various bases. Wound. It is a type of injury in which the skin is torn, cut, or punctured or where blunt force trauma causes a contusion. Classification of wound. 1. Open wound. It is a break in the skin's surface resulting in external bleeding. 2. Closed wound. The skin is not broken open and remains intact. Classification or categories of open wounds. 1. Incise wound. It is caused by a clean, sharp-edged object such as a knife, razor or a glass splinter. 2. Laceration. It is an irregular tear-like wound caused by some blunt trauma. 3. Abrasion or grazes. It is a superficial wound in which the topmost layer of the skin is scraped off. Are often caused by a sliding fall into a rough surface. 4. Puncture wound. It is caused by an object puncturing the skin such as nail. 5. Penetration wound. It is caused by an object such as a knife entering and coming out from the skin. 6. Gunshot wound. It is caused by a bullet or similar projectile driving into or through the body. There may be 2 wounds, one at the site of entry and one at the site of exit, generally referred to as through and through. Classification, categories of closed wound. 1. Contusions. It is commonly known as bruises, caused by a blunt force trauma that damages tissue under the skin. 2. Hematoma. It is called blood tumor, caused by damage to a blood vessel that in turn causes blood to collect under the skin. 3. Crush injury. It is caused by a great or extreme amount of force applied over a long period of time.